Hepatitis C in injection drugs used a hidden danger of the opioid epidemic. Hepatitis C. Hepatitis C is a serious infection of the liver caused by the hepatitis C virus. It is transmitted from person to person through contact with blood. Most people who are infected with hepatitis C do not experience any symptoms for years. However, hepatitis C is usually a chronic disease, which means it does not go away.
Of liver disease. In the United States in 2007, approximately 4 million people have been infected by the hepatitis C virus, with approximately 17,000 new infections occurring each year. Of these, approximately 3 million have developed chronic infection. In infected individuals, HCV produces an estimated 1 trillion new viral copies of itself every day. Understanding the life cycle of HCV replication is necessary to fully appreciate HCV infection. In infected patients, the hepatitis C virus attaches to plasma lipid particles, and together, they travel through the bloodstream to the liver. In the body, HCV targets liver cells, hepatocytes. This is because hepatitis C viral particles have proteins on their surface that bind to receptors on the surface of liver cells, such as the LDL receptor, CD81, scavenger receptor class B type 1, or SRB1, Claudin-1, and occludin. When these receptors are engaged, the liver cell internalizes the virus. Inside the liver cell, HCV dissolves its outer coating, releasing genetic material into the cytoplasm of the liver cell. This genetic material is in the form of a single positive strand of RNA, a molecule that contains all of the necessary information for HCV to replicate itself. This viral RNA migrates to the endoplasmic reticulum, where proteins are made to support cellular life. There, the viral RNA interacts with the ribosomes on the outer surface of the endoplasmic reticulum. These ribosomes then translate the genetic information to produce viral polyproteins over 3,000 amino acids long. These polyproteins are made up of 3 structural and 7 non-structural proteins, a total of 10 distinct viral proteins. This constant proliferation of HCV copies continues at an estimated daily rate of 1 trillion copies. HCV not only inhibits the body's antiviral defenses, it limits the infected cell's ability to self-destruct.
Symptoms for a period that can vary from 2 weeks to 6 months after being infected with the virus for the first time. Slight fatigue, discomfort in the joints and muscles, skinniness, lack of appetite, sensitivity in the areas of the liver.
Been infected with the hepatitis C virus. In fact, 4 out of every 5 people who have hepatitis C don't know they've been infected with a potentially serious liver disease. Those who do experience hepatitis C symptoms and signs will find they range from slight to severe. Fatigue is the most common chronic hepatitis C symptom, but those who have hepatitis C may also experience any of the following signs and symptoms. Abdominal pain. Stools will look different, often characterized by a clay color. Urine will also look different, becoming darker and even coffee-colored. The patient is likely to experience an unusual amount of itching. The patient will have unusual headaches. Jaundice, which makes the skin and whites of the eyes look yellow. Individuals with hepatitis C sometimes experience a loss of appetite. Muscle aches. Some of those who have been infected with hepatitis C will suffer nausea and vomiting. Hepatitis C is caused by the hepatitis C virus, which is also commonly known as HCV. Most of the time, an exchange of blood is needed to transmit the virus from one person to another. It is not usually transmitted through sexual contact. In the United States, hepatitis C is transmitted more frequently by unclean needles used for illegal drug injections than through any other means. 2 of every 3 patients who have acute hepatitis C go on to develop chronic hepatitis C, which is an extremely serious type of liver disease.
Fatigue, second, common type, loss of appetite, and jaundice, and yellowing of the skin and the white of the eyes. A low fever up to 100 to Fahrenheit, cause the virus is transmitted from person to person through contact with blood. People who use intravenous drugs can get hepatitis C when they share needles with someone who has the virus. Health workers, such as nurses, laboratory technicians, and doctors, are often exposed to hepatitis C. They can be infected if they accidentally puncture a needle that was used on an infected patient. Application in medicine and discovery and the study of HCV and its complications and the recent development of highly effective treatment with cure rates of greater than 90% are true of modern medicine, but this success has fostered a false sense of the cure are curable disease is the among a conquered disease that no longer warrants high priority investment. Opioid-related HCV infection and its sequel, however, affect growing numbers of people. Opioid epidemic transmission of other bloodborne infection, particularly HIV and hepatitis B virus, is also increasing among injection drug users, albeit at a lower rate. The opioid epidemic has also been linked to increasing rate of syphilis and other sexually transmitted infections, microbial endocarditis, and other infections associated with use of drug injection.
If you look at the prevalence of hepatitis C, it was really decreasing quite a bit through 2010. And since 2010, it's starting to rise again. And we're seeing it in a young population, unfortunately frequent women in rural areas. It's part of the opioid epidemic. So generally these were people that were treated with opioid narcotics for acute pain. They became addicted to those medications, and nobody then would refill them or treat the addiction to get them off of those medications. Many of these people were under or uninsured as young people, and they resorted to using heroin, which was much less expensive, more readily available on the street, but unfortunately it's also injectable. So they went from oral prescription opioid narcotic pain pills to injectable heroin, a fairly quick leap that a lot of addicts don't do for many years. They'll use other medications. So it's unfortunate this young population that's getting infected, they don't know about the risk factors, blood-to-blood transmission, they're sharing needles, they may not have enough money, and we're seeing this group of women also becoming pregnant during the time while they're still using, and we're seeing actually a higher chance of passing the infection from mother to baby, generally at birth. So it's a real public health problem, but it's complicated, because there's a bit of a pushback. Nobody wants to introduce needle exchange programs, and some conservative, very rural areas. Inner city clinics usually have these programs available, but I think this is an area and regions of the country too that don't have a lot of support, and a lot of it is education about this population too.
Pros, the opioid crisis and related HCV epidemic underscore the importance of continued investment in HCV research. More accessible HCV testing could prevent transmission and HCV-related disease by facilitating early identification of infection and linkage to care. Major strides have been made in understanding HCV infections and association disease.
It lasts just a few weeks, but sometimes the virus stays in your body, causing a serious chronic illness that raises your chances of having cirrhosis and liver cancer. For some people, their immune system is able to fight off the infection, but others may need treatment. Until recently, only 2 medicines were used to treat Hep C, interferon and ribavirin, but these drugs often required weekly injections for almost a year, only cured about half of those treated, and caused life-threatening side effects. Now, new treatments called direct antiviral agents, or DAAs, are available that are safer, faster, and more effective than the old ones. By taking just 1 pill a day, the medicine works by attacking the hepatitis C virus and blocking the enzymes it needs to multiply. Therapy with DAAs usually cures most people in only a
Cons. Reflection is a major concern when treating people with a history of injection drug use. People infected with HCV genotype 3 and people with liver cirrhosis are least likely to have a response to the treatment. Drug resistance can emerge in patients with multiple treatment failures. Issued applied in Ecuador of the estimated 3.5 million persons with chronic hepatitis C, the vast majority of one acquired HCV decades ago from blood transfusions, contaminated medical equipment, or parenteral drugs use. HCV-related mortality has been increasing for decades and trend that is especially pronounced for HCV-associated liver cancer. From 2013 on, the number of HCV-related deaths has exceeded the number of deaths associated with HIV, and 59, 90 after infection disease community on health actions, public health actions to prevent HCV-related disease and death are focused on testing people at risk for HCV and connecting infected people to proper medical care and curative treatment.
Grateful to have a liver that feels normal. A former drug user, she'd been diagnosed with hepatitis C and knew how deadly it could be.
Through what my uncle went through, he went through liver failure, had a liver transplant, and then his body rejected it because he was infected all through with hepatitis C.
A new miracle drug is available.
Well, there are actually 2 companies that have drugs on the market now for hepatitis C, but the one that's getting the most press right now is Harvoni, which is a 1 pill once a day treatment. It's a combination of 2 medications, and the incredible feel of this whole situation is we're seeing people cured within as little as 8 weeks of treatment.
But it's costly, about $1,000 a pill. Dr. Bob Wallace, who opened this clinic to treat the uninsured and underinsured, is helping patients like Jane get the drug for free.
We've been able to get a company to pay for certain blood tests that patients have to have before we start them on treatment. And once we get these blood tests done, we can apply through the pharmaceutical company, through a patient assistance program, and the company provides this treatment for free.
And it's working. Jane's last test came back free of hepatitis C.
He's my hero. He saved my life.
But now Dr. Wallace's clinic needs help. Run on mostly donations, he needs the community's help to keep helping others.
It's one of those things where you never think it's going to happen to you, and it can happen to anybody.
Question. The opioid epidemic is a stark reminder of the consequence of a social problem that remained hidden for years, in part because of the stigma associated with drug use and the reluctance to confront it as a public health problem. The concurrent spread of HCV, if not controlled, will similarly have public health and financial repercussions for decades to come. Thank you.